Hi, my name is Dr. Brendan Wright, and you found me because you were wondering about the best treatment for herniated discs in your spine. I am a chiropractor. I've been practicing in the Franklin, Tennessee area for over 21 years now. I'm at Crist Chiropractic, and I want to explain to you what that best treatment is for herniated discs. Let me go back in time a little bit and explain to you why I'm even interested in herniated discs. When I was in about 7th or 8th grade, my mother started having back surgeries, and I felt then, way back then when I was young, there's got to be something better to do than having surgery on your spine. Just removing body parts is not the best option. It can't be. So let's fast forward. Now at age 70, my mom has ended up having to have 12 spine surgeries. So do you think if I thought there was a better option back then, I would have recommended it to her? Of course I would. Every day of the week and twice on Sunday, as they say. So the best option for herniated discs is non-surgical spinal decompression. Let me explain to you a little bit about what that means. If you look at a spine here, spine model, this is a normal section of the spine. A good healthy thick disc, plenty of room for the nerves exiting on the sides of the spine. And the reason that those nerves are so important is because those nerves go to every muscle, every organ, every cell in your body. So you've got to keep the pressure off of those nerves so they can function optimally. So if we go forward a little bit, or backward actually, as the case may be, if your discs start to degenerate or thin out, your spine will start to look like this. If it gets even more advanced, you'll have bone spurs form, a lot more disc degeneration, a lot of pressure now that's beginning to build on the nerves exiting the spine. If it gets to this point where your spine has fused, there's not a whole lot we can do for you. You're a surgical candidate at that point. Don't want to let you get to that point. So spinal decompression is the best thing for you. Let me explain to you how that works. Spinal decompression does exactly what it sounds like. When your discs are compressed, like you see here, they need to be decompressed or pulled apart. And so that's exactly what the spinal decompression does. You're lying on your back, very relaxed. Most people take a nap when they're on the table. The table will gently open and separate the vertebrae, and when they do, they'll create a vacuum or a suction inside the disc space and help to pull water, nutrients, and oxygen back into the disc space to help fill it back out and make it healthy again. If you imagine the disc is kind of like a sponge, and so when a sponge dries out, what happens to it? It gets brittle and gets thin. And then when you rehydrate it, it fills back out again and becomes pliable. That's what we need to accomplish inside the discs when they're degenerated. Now, when the discs are herniated, like what you were wondering about, imagine now that the disc is kind of like a water balloon. What happens to a water balloon if you put your hands on either side of it and press down? It squeezes out to the side, right? And that's exactly what a disc herniation is like. The disc is squeezing out to the side, kind of like you see here. So when we use the decompression and pull apart, that disc is suctioned back in toward the center and away from the nerves that are being compressed. So if you have any questions about spinal decompression, please feel free to visit our website. That's CristChiropractic.com. That's spelled C-R-I-S-T, chiropractic.com. And we'd love to give you some more information there. If you happen to be in the Middle Tennessee area, we'd love to have a visit from you as well. Please feel free to come by anytime.